Good afternoon, and thank you for joining me and our distinguished panel for what I know will be an engaging and an enlightening conversation about the implications for women's health on two landmark pieces of legislation: the Biden administration's American Job Plan, as well as the American Families Plan. As we slowly emerge from the grips of a very long and difficult pandemic, we are at a pivotal moment for women's health in this country. As women continue to face mental health issues, delayed women exams, delayed mammograms, and other postponed cancer screenings, job and financial insecurity, and the anxiety of navigating healthy living in a post-pandemic world. Our panelists bring a diverse set of viewpoints on the current health priorities affecting women, and I look forward to a lively, respectful, and thought-provoking discussion on where we go from here. I would like to thank all of our panelists for their time today and to extend a special thank you to Healthy Women's Corporate Advisory Council members that have helped make this briefing and so much of Healthy Women's work possible. AbbVie, Amgen, Astellas, Covis Pharma, Eli Lilly, Esperon, Hologic, Myovant Science, Pfizer, Novo Nordisk, and Pharma. And now, I am delighted to pass the baton to Arika Pierce, founder and CEO of the Millennial Boardroom. Arika will be moderating the panel today, and she brings an incredible depth of knowledge in healthcare policy and the healthcare industry, having served as a former US Senate staffer, as well as the youngest vice president of a publicly traded healthcare company. Arika, we are so lucky to have you helming this discussion. The floor is now yours.
Thank you so much, Beth, and I'm very excited about this discussion today. I think it's very timely, and I really am thrilled that Healthy Women is hosting this panel discussion. Before we kick off and jump into our panel, we do have a great special guest that will provide some remarks and really give us some insight straight from the administration on these two very important pieces of legislation. We have Catherine Oakar, who serves as Special Assistant to the President for Community Public Health Disparities, and prior to that, she worked for the Biden-Harris transition. Prior to that, she worked as a senior advisor to Waxman Strategies Consulting on public health, nutrition, and healthcare issues. And she also served in the Obama administration. Thank you so much, Kat, for joining us today. We know you're probably very busy at your day job, but we appreciate you providing some insight on both the American Jobs Plan and the American Families Plan to level set the audience in terms of the priorities of this administration. Thank you, Catherine. Kat, sorry.
Oh, no, that's okay. Call me whatever. It's so great to be with you. Thank you so much, Arika. I'm just delighted to be here with you all today, and to the Healthy Women team on a personal level and as part of your key demographic. I appreciate all the work that you're doing to educate women about how to stay healthy and make informed choices. I am at your website quite a bit personally, and just think it's such a tremendous resource. And so today I'm here to talk about, as Arika mentioned, some of the administration's priorities as they relate to women and women's health. And so I wanted to start with just kind of a big picture perspective. The president has talked a lot about the four crises we face at this moment. First and foremost, obviously, is COVID. And we've made tremendous progress, but we really need to continue marshaling every resource at our disposal to beat this virus. As I'm sure you've heard over and over again, the president has set a goal of vaccinating 70% of American adults by July 4th. And so we're really pushing hard to meet that goal. And so I would encourage each of you, especially those with far-reaching networks and your districts and your communities, to become part of the COVID-19 Community Corps. You can check out wecandothis.hhs.gov. It's a really tremendous resource. It will give you some really good information to share with your family and friends, social media content, and literally you will be part of the other hundreds of organizations that are also part of that core. So the COVID crisis is crisis number one. The economic crisis is obviously a part of that. COVID has caused massive economic disruption, and we need to really help American workers get back on track. And that is part of that is getting people jobs. Part of it is restoring the basic promise that if you work hard, you should be able to get ahead. And that includes having health insurance, comprehensive, affordable, quality health insurance. The third crisis he often talks about is the crisis around racial justice. You know, we are in the midst, I don't have to remind this group, but we are in the midst of a national reckoning on racial justice. And as we continue to see the truly tragic human costs of systemic racism and equities that persist year after year, and undoubtedly we see those in health outcomes as well. And so the fourth crisis that the president often talks about is the climate crisis, and how radical intervention is truly needed in order to really address that. And so these four crises are really driving much of our work. And undoubtedly, COVID-19 has thrown daily life truly off of its axis. And we know, as well as anyone, that women are often the ones who are forced to make these difficult decisions for the well-being of their family. We know that many women have struggled in this economy. It was hit hardest in female-dominated industries. Many are continuing to work in essential jobs, whether it be on the front lines of healthcare or in grocery stores and restaurants. And truly, I think we can all agree that women have really helped shepherd us through this crisis, and oftentimes without the critical support they need, like affordable childcare, like paid family leave, paid medical leave, flexible and predictable schedules, and at times health insurance. And so this was really one of the reasons why one of the first things we did right out of the gate in the administration was opened up a special enrollment period in the marketplace. And it's been so exciting. If you had told me 4 years ago that this is where we would be at in terms of the numbers, aside from the pandemic, I might not have believed you, but this is why we're seeing historic highs in the number of Americans that are getting covered through the ACA. 31 million total, I think we're at, including over 1 million because of the special enrollment period alone. So it's really an incredible feat. And I would encourage you to spread the word on that. I feel like I'm giving you a lot of do-outs, but the special enrollment period goes until August 15th. And so I'd encourage you to point anyone who might be interested to healthcare.gov. And so even though we are climbing out of this pandemic, there's still millions fewer women in the workforce than before the pandemic. And we know we need to, as the president often said on the campaign trail, build back better and build an economy that works better for women, a healthcare system that works better for women, because we really truly believe that healthcare is a right, not a privilege. And it is key to women's well-being and economic stability. And so the American Rescue Plan was really the first huge step in delivering for women that we took it as an administration, and really speaks to many of our priorities, including reducing healthcare costs. It does a lot to reduce the healthcare costs for those women who purchase coverage through the marketplace, so that they can get those well women visits, they can get FDA approved contraception, they can get breastfeeding support. And so that was one of the key pieces of that. It invests in the care infrastructure, which, as we all know, has been chronically underfunded, including additional Medicaid funding for home and community-based services. It also invests and really tries to improve maternal health. It makes it easier for states to expand Medicaid postpartum coverage from 60 days to 12 months. So we're really trying to ensure that new moms can stay healthy and keep that peace of mind that health coverage provides. As you likely know, addressing the unacceptably high rates of maternal mortality and morbidity in this country, particularly among Black and Indigenous women, is a priority of this administration. And so this is really step one in our efforts to improve that. But we all know that healthcare isn't just what happens inside the doctor's office. It is inevitably related to your job, to the place you live, to the food you eat. And so the American Jobs Plan is really building on that, as we call ARP Foundation, the American Rescue Plan Foundation, and really speaks to many of our priorities in the administration. So we're trying to put millions of Americans into good paying jobs. And that includes investing in, as I mentioned, a robust care infrastructure. But it would also deliver high speed internet to every American home. And I know that's kind of like, why does that relate to health? But I feel like it's kind of a no brainer. Like, we need that to ensure people can access to telehealth services, which have really boomed given COVID. And I think the American Jobs Plan, we often say, is also to ensure that the economy is built on a foundation of equity. And so we're trying to strengthen the workforce pipeline for more women, more communities of color, to access those in-demand, high-paying jobs. And so this to us means ensuring jobs with fair and equal pay, safe and healthy workplaces, workplaces free from racial, gender, and other forms of discrimination and harassment. So that's the American Jobs Plan. The American Families Plan builds on that even further and really helps us continue some of the focus on ensuring healthcare is affordable by extending many of those premium tax credit enhancements from the American Rescue Plan. But it also seeks to invest $3 billion to improve maternal health. And so that could be a range of things, whether it be investing in the perinatal workforce or training for healthcare providers. So we're super excited about that piece of the Families Plan as well as the Affordable Care Act elements. And I wanted to kind of close by talking just a few minutes about some of our additional priorities. Certainly the American Jobs Plan, the Families Plan are huge priorities for us, but there are other priorities, and I feel like we have endless priorities on women's health especially. And so the crisis of racial justice, and I know I talked about this at the top, and health equity is something we take super seriously. And this comes all the way from the president. We know race and place matter a lot for health outcomes, and nowhere are we seeing that more, or nowhere are we seeing inequity exacerbated more today than by COVID. And so we're truly trying to, as we say in public health and in healthcare, reach people where they are. And that includes in our various initiatives, whether it be Black-owned beauty salons serving as vaccination sites or mobile vaccination clinics, reaching women in rural areas, or even those who are on the dating scene using apps like Tinder and Bumble and Match.com. So we're truly trying to reach people, young people, especially where they are, especially communities of color who may be lagging in vaccination rates. But we're also thinking about advancing health equity beyond COVID. And so certainly family planning and reproductive health is very top of mind for us. At the start of the administration, the president issued a memorandum entitled Protecting Women's Health at Home and Abroad. And it was really our first step. I think it was like maybe just a week in trying to really protect and expand access to comprehensive reproductive health care. And so this really, to me, is reflection of our support and desire to protect women's and girls' sexual and reproductive health and rights in the United States and globally. And so to date, I'm sure this group is familiar with the proposed rule we did on Title X, the family planning program. And with that, it's really, our goal is to really ensure access to equitable, affordable, client-centered, quality family planning services. And we know how important this program is, not just to ensuring family planning services, but to preventive services, including breast and cervical cancer screenings, among others. So family planning and reproductive health is certainly a priority for us. Expanding coverage, whether it be providing incentives to expand coverage, including in Medicaid, or looking at policies that might undermine Medicaid and make it harder to enroll, because our goal is really the exact opposite. It's to strengthen it and protect it. We also have, the president has committed to, and we've talked a lot about doubling our investment in community health centers. Certainly we've seen how incredibly impactful they have been in the pandemic, and are hoping to continue to bolster funding for them. Undoubtedly investing in the public health workforce, and we started to do that through the American Rescue Plan, but individuals like community health workers are top of mind for us, especially those who, we know that people who have better health outcomes when they receive care from somebody who looks like them. And so really bolstering the public health workforce from the ground up is top of mind for us. Achieving mental health parity and expanding access to mental health services, helping women return to care. I think it was said for a moment at the top, we know many women have delayed care, the care they need due to the pandemic. And so trying to ensure that women are able to get the mammogram that they missed, or just a general checkup that they've been putting off, is certainly something that we're focused on. Also are eager to defend a lot of the healthcare protections, regardless of race, ethnicity, sexual orientation, or gender identity. And for those of you in the biz, it's often called Section 1557 from the Affordable Care Act. And then lastly, just to reiterate, really reducing the unacceptably high maternal mortality and morbidity rates, especially among women of color. And so we have a lot of priorities when it comes to women's health. I think I can probably continue, but I will stop there. But I think we too see that ensuring people's health, especially women's health, is a critical part of having a strong infrastructure. And so I'm super excited to see so many on the call today. And thank you so much again for having me. And I'm happy to take a question or two before you get on with the rest of your program.
Well, thank you, Kat. I think you really have underlined how critical and how much of a priority women's health is right now and for the administration. Just have one quick question. I know we need to let you get back to all of these priorities, but all of these areas that you've mentioned, where do you see the most opportunity for a bipartisan path forward?
A lot. I think the president is super committed to doing this, doing as much as he can and having bipartisan support as much as possible. But I think there's a lot of avenues. I think one is certainly maternal health. We've seen a lot of maternal health champions on the Hill, whether it be the Momnibus or other maternal health efforts, whether it be bolstering the perinatal workforce or improving data collection. So I think there's definitely an opportunity there. I think, but then in the long term, enhancing funding for community health centers. I think it was no doubt we have seen for a long time how incredible community health centers are. And I think the COVID-19 pandemic laid bare really how incredible they are. And so I think bolstering the federal investment for them, I think is certainly achievable, but I think there's no shortage, I think, bipartisan opportunities, and we're excited to work with Congress to hopefully move them forward.
That's great. That's great. And as I'm sure you already know, this community is here to also help work to move these priorities forward as well. Thank you so much, Kat. We really appreciate your remarks and your insights today.
Thank you so much for having me.
Let's transition into our panel. I just want to add, if you have any questions that you would like to ask any of our panelists, please type them into the chat box. We'll have a little fireside Q&A after we have a chance to hear from each of our panelists. But before we do get started, I did want to touch upon just some of the things that Kat just highlighted, both within the American Jobs Plan and the American Family Plan. Next slide. So first, just within the America's Jobs Plan, as Kat just highlighted, this is really focused on rebuilding a new economy, focusing on our infrastructure. Many of you may already know this, but the US is the wealthiest country in the world, but we actually rank 13th when it comes to overall infrastructure. So there's a lot of opportunities for improvement here. And that's really the focus of this piece of legislation. While it's a massive package, I believe it's over $2 trillion in investments. A couple of areas that we did want to highlight is that there is $400 billion allocated to support the care economy. And this is really focused on expanding home and community-based services under Medicaid for older adults and people with disabilities. There's also investments allocated in increasing the support workers. So those who work in areas such as home health care and the overall home care workforce, those wages would be expanded and increased. And then there's also $100 billion, as Kat already indicated, around reducing the cost of broadband internet service. As she highlighted, especially as we move to a more telehealth-focused healthcare system, this is really important, especially in rural and urban areas. Next slide, please. In terms of the America Families Plan, as she indicated, this really builds upon the American Jobs Plan. And this is really to make sure that the right investments are there for our children, our families, and for the middle class. The plan mentions lowering Medicare eligibility and expanding Medicaid in the states which have yet to expand it, and also potentially creating a public option. There's a $200 billion proposed estimate to permanently expand the ACA premium and tax credits to ensure that no individual spends more than 8.5% of their income on health insurance. There's a $225 billion proposed investment in addressing the child healthcare needs of families to ensure that no family spends more than 7% on childcare, and that is a critically important, especially as we think about the costs that many women especially have to spend on child health care. And then lastly, there's a comprehensive paid family medical and leave proposal. And as we saw throughout the pandemic, again, greatly impacting women, there's really a need to make sure that there is paid leave. And so the proposal includes a guarantee of 12 weeks of paid parental, family, and personal illness and safe leave, as well as all workers receiving 3 days of bereavement leave per year. So very high level overview for you, but did want to level set that as we move into our panelists today, who will speak in more detail about some of these provisions and provide some greater insight. So with that, we will move to our first panelist, which is Megan Herber of Drinker. Megan works with a wide range of clients on digital health issues, including telehealth, digital therapeutics. Prior to that, she worked on Congresswoman Doris Matsui and handled her healthcare portfolio as she was on the prominent House Energy and Commerce Committee. Megan, thank you so much for joining us. Can you provide us with some opening remarks, and then we have a little Q&A for you.
Absolutely. Thanks so much, Arika. Thanks for Healthy Women for having me. I wanted to take just a couple of minutes here to talk about provision and kind of a concept within infrastructure that I think is critically important, which is telehealth. And I think as a part of infrastructure that's important for both health and for women. As Arika mentioned, I work a lot on telehealth and digital health issues, among other healthcare issues for healthcare clients. And we work with the American Telemedicine Association, among others who are interested in this. And we can actually go to the next slide, and I'll talk a little bit about telehealth and infrastructure. I think Kat's presentation was really helpful in terms of what the Biden administration is thinking on infrastructure. And I know we'll hear from perspectives from both sides of the aisle on this. But the things that I would flag that Kat talked about in particular, she mentioned broadband being super important for health and for women. And I think that will be key for infrastructure and key for telehealth, right? So during the COVID-19 pandemic, we've all experienced this increased access and increased utilization of remote care, right? None of us wanted to go into the doctor's office when the pandemic hit, or access normal in-person healthcare services. So we all kind of have had new experiences, whether we're healthy or whether we've had chronic conditions to address. Everyone's had new experiences with the healthcare system in a virtual manner. And a lot of those experiences have frankly been really positive. Patients have been able to interact with their providers in new ways, and whether it's through apps or remote patient monitoring or text-based services or a video visit, it's not always perfect and it's not always a replacement for in-person care, but it can be a really good way to get access to care that you might not have otherwise accessed. And I think that gets to the second piece that Kat really focused on, which was racial disparities, right? Right now, if we don't have full access to broadband, the utilization of telehealth continues to highlight existing healthcare disparities in our system. But if we can increase access to broadband, I think that telehealth and remote care really have the potential to bridge that gap for people who don't always have access to healthcare, whether it's because you're in a rural area and it's far to drive, or you're in an urban area and you don't have childcare, or you can't take off work, or just getting across town is difficult, or accessing a specialist is difficult. I think having access to remote care can really, really make a difference there. So I just wanted to take a second to talk about policy that has occurred during the pandemic and potentially what might happen post-pandemic. So as I said, we've all had this experience. Congress at the beginning of the pandemic loosened a bunch of the federal related restrictions on telehealth and remote care at the beginning of the pandemic, since we all needed it. And that has continued throughout the public health emergency. But what's really important to flag from a policy perspective is that a lot of those flexibilities in policy, especially at the federal level and some at the state level as well, are very much tied to the public health emergency. So we'll switch back off essentially without additional policymaker action once the public health emergency ends. So the biggest one at the congressional level is the Medicare geographic and originating site restrictions. So pre-pandemic, Medicare covered a very limited amount of face-to-face telehealth services, and you really had to be in a specific rural geographic area in order to access telehealth, the traditional telehealth face-to-face in the Medicare program. And that, of course, has been lifted during the pandemic, but if Congress didn't act before the public health emergency ends, that would revert back. And so we've been calling that the telehealth cliff, right? Now everyone's had access to these services. To me, it makes zero clinical sense that if you're in one geographic area, you'd have access, and if you're in another geographic area, you wouldn't, especially in a program like the Medicare program that should provide the same benefits to everyone. So it's something that Congress is really looking at. So next slide. So like I said, Congress is really thinking about this, and there's been lots and lots of bills introduced this Congress already just since January, talking about telehealth, but wanted to point out a few key pieces of legislation for everyone, and happy to answer further questions on any of this. But 3 big bills that address those Medicare restrictions and would look at what happens to telehealth post-pandemic. The Connect for Health Act is a longstanding piece of telehealth legislation that's been around for multiple Congresses, was just reintroduced. And it's one of those, I kind of call it a kitchen sink bill, but a lot of times throughout the past few years, Congress has picked out provisions of that bill and passed them into law. So there's been a Medicare Advantage provision, there's been some telemental health provisions that have been passed into law. So the updated version that was just reintroduced kind of takes that into account and looks at a lot of those Medicare provisions. Similarly, there's a Telehealth Modernization Act that came out of the Senate Health Committee following a hearing last summer, but it's now bipartisan and bicameral, so in the House and the Senate, and it also addresses the Medicare restrictions among some other things. And the third bill, the Protecting Access to Post-COVID Telehealth Act, is Congressman Mike Thompson from the Ways and Means Committee on the House side, one of the leaders of the Telehealth Caucus, and he's got a bipartisan group of the Telehealth Caucus on the House side supporting that bill as well. So all 3 of those address that big cliff, but of course there's lots of other topics that need to be addressed as well. Lots of talk about audio only services, especially for those who don't have access to that broadband service. Lots of talk about licensing, which has a lot more state jurisdiction, so I can talk a little bit about that. Lots of focus on telemental health. Over the past few months, there's been a lot of congressional hearings on telehealth, but also on just mental health and behavioral health services during the pandemic. And in every single hearing, telehealth comes up because that's how people have been accessing care. So wanting to keep that option available for folks. And then of course, broadband funding, as I mentioned. So really quickly, I'll just kind of wrap up on the policy side. Like I said, there's been a lot of committee hearings, but there's differing kind of opinions about how to act. The Biden administration early on announced that they plan to extend the public health emergency through the end of this year, through 2021. So we would expect that all the telehealth flexibilities remain in place at least to the end of this year, which is wonderful and fantastic. And it gives patients and providers some stability in knowing that they can still access these services for this year. However, Congress tends to act when there's a cliff or an urgency or a deadline. So realistically, we kind of assume that Congress may not pass permanent legislation until closer to that deadline, so closer to the end of the year or whenever the public health emergency expires and these things are about to go away, is when Congress might address them, although of course they're already thinking about it. But wanted to point out that the Medicare Payment Advisory Committee, MedPAC, has recommended to extend the flexibilities post-pandemic to give Congress and clinicians and others time to kind of analyze the impact of the flexibilities and the changes in policies. So that's a potential option, as well as, you know, Congress could just permanently fix things, or they could say, you know what, let's extend the flexibilities that we gave during the pandemic for a year or 2 or 3 post-pandemic, and kind of collect data that way. So those are kind of different pathways that may happen on the telehealth policy front. So with that, I think I will stop and happy to answer any questions.
Thank you so much, Megan. I think we've all experienced some level of telehealth likely in this past year. You actually answered the question I wanted to ask you, which was really around, you know, where Congress and the administration would be headed to make these flexibilities permanent now that sort of the genie is out of the bottle when it comes to telehealth. So it sounds like you would agree it's likely going to be closer to the point where we're actually looking over the cliff.
Yep, exactly. And I will, to that point, just flag, you know, telehealth has been a very bipartisan issue, right? The Trump administration made a lot of headway on things like access to remote patient monitoring and was interested in embracing innovation. I think the Biden administration has similarly embraced the topic, and we've had a lot of good conversations. And on the Hill, it's been completely bipartisan. So we're really hopeful for progress.
Excellent, excellent. Thank you so much. Now I'd like to introduce Susan Zook. Susan is the founder of Mason Street Consulting, where she advises clients on the intersection of business development and healthcare policy. Prior to founding Mason Street Consulting, she held several high-level positions in the federal government, including being the healthcare policy advisor to Senator Mike Crapo, who was ranking member of the Senate Finance Committee. Thank you so much, Susan. Could you provide us with a few opening remarks?
Sure, and thank you so much, Arika and Healthy Women, for allowing me to come and share my thoughts today. I've obviously, being a woman in this industry is obviously, one of those more unique situations. We are, struggling with parity too, and it's lovely to see that the work that Healthy Women is doing on that front as well. The form and foundation of Mason Street Consulting is basically to provide parity in the government relations space. There aren't a whole lot of, women consultants, and when I looked around and I was internal at a few corporate companies, I realized I kind of wanted to provide that to the industry. So from my own personal perspective, just really glad that we're having this discussion today about how we can help women. Certainly the pandemic, I have small children. I'm a full-time mom and a full-time business owner, and certainly all of these challenges we're talking about today have really impacted my life as well. And very encouraged to hear the Biden administration look at ways to provide help to, these challenging times. And I think for today, I just sort of want to discuss what I see are, major themes from the Republican perspective. I think there are a lot of similarities, even though we listen to the news every day, and it seems like they're very far apart. I think actually they are very close in the way and the perspective that they want to provide a better quality of life. And I think both sides are coming from that perspective. And I just wanted to sort of share, some major themes. I think it's hard right now to hear a whole lot of response because, the president is new to this administration, and there haven't been a lot of legislative text out to wholeheartedly respond to. I think these are ideas and themes. And so this is just sort of a general sense of what I see are Republican themes. And I think Megan really hit the nail on the head. I know I have used telehealth a lot in the last year. And just as a working mom, it has been so helpful to me. Certainly we want to be able to expand flexibilities in telehealth. And, I used to work for a Western member who comes from a very rural area, broadband, very, very useful and helpful to those individuals who live and need to provide and have access to more healthcare. I think, again, another theme from the Republican perspective and seems to be very, very similar to the Biden perspective, is being able to afford healthcare. Health insurance, when we all came into this discussion together, it's sort of a great weight on the American family and the American individual. I know I made a business choice to come out and open my own business with that sort of weighing on me, right? To be able to provide and for your family, and also make enough money to just baseline provide insurance for everyone is very, very difficult. But I think providing, coverage and options and expanding safety net programs. I know we're all on this call, so we weren't able to hear the hearing today in finance about the HHS budget. Secretary Becerra is testifying right now. But expanding health community-based services is absolutely on the Senator Crapo's agenda. Very supportive of doing that. Probably different avenues to do that than what the president's taking up, but certainly people who are disabled, and if you're a I don't know how, I mean, I'm struggling to keep care of my children, but if you are just dealing with a disabled child, or you have that caretaking in your life, that's very difficult. We should be able to provide a baseline of those services to help. Again, being able to provide access to private sector innovation is so important. When you look in the telehealth space, all of the, I think everyone across the board, again, we'll go back to telehealth, but the incredible spirit of America, right? Wow. Some of the innovations in the space around telehealth, how you're providing services and how you're able to get healthcare. We should be able to provide better support and avenues to those technologies. It's very difficult, obviously, to get things approved to the FDA. We've seen a whole new agenda for that, just given how much we needed to get vaccines approved, and also, anything PPE, anything that was coming through that could keep people safe and also contribute to people being able to provide access to healthcare. Again, I think, one of the things that we'll talk about that maybe is not really on the agenda of the Biden administration, but certainly is on Republicans' radar screen, it's just, and we keep coming back here, and I think it's an uncomfortable conversation, but we are not dealing with an economy that can sustain the amount of money we're spending in the Medicare program long term. The cost curve in the Medicare program is sort of how we came to a lot of these discussions about what we're going to do for the future of Medicare. It's nice to be able to say your parents are going to have more and more, help and benefit, but are my children going to pay for that? And it's a question that we have to be concerned about, especially when we've spent $4 trillion over the last year sustaining and supporting our economy and our healthcare system. Currently, the Medicare Trust Fund will run out in 2026. That is really crazy. That's like 5 years away. And we are counting on the private sector to come up with innovative ways that have been working in the private sector that we can also implement in the public sector to help us contain the cost curve. And we want to be able to have as many benefits as possible in the Medicare program for future generations. And we need to be very careful about following what our next spend in that program will be. And so I think that is probably the little bit of the diversion. Again, I think all of these themes are definitely providing a better healthcare system. We know that there are just some things that are broken, and there are some bright spots that we need to expand and move forward with. And I think that we can get there in some really positive ways. I think another thing I didn't necessarily mention, but I know as a common theme is also just mental health in general. It has been quite a year to be locked inside your house and not have resources. I mean, I'll just use put my female hat on. I had a group of girlfriends and we would meet after work and sort of decompress. And, I'm certain that has really just stifled motivation and your perspective and how you're dealing with life. So certainly we need to be able to get out of this hole and help people access whatever resources they need to get back to regular life. And I think from both sides, we know that we're having a real problem with accessing providers, social workers. I think both sides of the aisle are very much inclined to do what we can to be able to open those channels, to be able to provide more resource. Mental health is, it's very challenging and upsetting to see. I know the overwhelming uptick in suicide prevention hotlines. I was with a senator recently where he said that really he was meeting with them, and that talking point really is that the suicide prevention hotline has become the network to access a mental health worker. And that's really crazy. I think that we absolutely have to do better. And there are lots of different legislative paths and avenues and bills out there that we can pursue on that front. So I'll turn it back over to you, Arika. And again, thank you so much for allowing me to come on today. I really appreciate the time, and I love this country and the work I do, and just always glad to talk about it.
Thank you so much, Susan. Really appreciate your insights. Just one quick question. So it sounds like, there really is a lot of common ground from your perspective in terms of some of these issues. But, the cost of Medicare, certainly you touched upon that one being where we may be a little bit, the two sides might be a little bit further apart. How would you, in terms of common ground, like what are your thoughts in terms of how this could move forward?
A really good question. Certainly I actually worked on the Hill 10 years ago. It was 2011. So we were in a similar situation. I think that we just have to be very open-minded and sort of have a deadline. I think that there's a possibility of getting there. Typically that when we have kind of this need to use both sides of the aisle, we kind of get to a place where we can, I think, both innovate like legislatively and come up with something. Certainly we've gone through the spectrum, but I'll just give an example. I think, during Affordable Care Act, we discussed ways to, pay for expansion, and it ended up being through the Medicare Advantage program. Cuts to the Medicare Advantage program. And so we went through a period of time of feeling like that was not actually a good program. And then we went through a period of time where we tried to, understand that traditional Medicare is a 20% copay on everything for a senior, which if you're a sick senior is a really bad program. And then we came back around to saying, well, Medicare Advantage might be a good program. And so I think we had gotten on a good place. I think that Senator Crapo and Senator Wyden have worked very diligently on that program to provide guardrails. Certainly the flexibilities are there, the extra benefits are there. And they have, very closely worked together as members of the Pacific Northwest delegation over the last decade, even more decade. I think they've actually worked together for almost 25 years. So they know each other really well. And I think similarly situated in this sort of space, there will be something like that program that, might have its ups and downs, but we can definitely work on together.
Thank you so much, Susan.
Sure.
Great. Next, we have Dorianne. We have Dorianne Mason. I was thrown off by Mason Consulting and Dorianne Mason, who is the Director of Health Equity at the National Women's Law Center. Additionally, she serves on the Women's Committee for Institute for Medicaid Innovation and is a Sargent Shriver National Center of Poverty Law Racial Justice Fellow. Hi, Dorianne.
Hi, thank you, Arika, for that introduction. And of course, thank you, Healthy Women, for having me here today. I love when I plan remarks and things that I have planned to say have been said either before or many times before. So I'm very excited to hear that health has been talked about so comprehensively here, because health is about much more than simply coverage and care. Health is impacted by every facet of a woman's life. And so when we're talking about health and infrastructure and what policy decisions we should be making to support women, we have to talk about it really comprehensively. And so even today, when I'm talking about, what are the significant pieces in the jobs plan, we actually have to look at how these different pieces work together. So it's not just the American Jobs Plan, it's also, of course, the American Families Plan, and also how that interacts with the American Rescue Plan that's already been passed. Ultimately, what we know is that financial security is a significant component of a woman's health, right? Women of color, particularly, and women of color, or women really more broadly, are still being impacted by the pandemic. Even though unemployment rates have declined, we know that more than 1 in 12 Black women are unemployed, and we have more than 1 in 13 Latinx women who are also unemployed as of April 2021. And as mentioned earlier, but without a specific number, 2 million women have dropped out of the workforce completely since February 2020. So millions of women and families have lost employment income, are facing food insecurity, housing insecurity, and how does that impact their health, and what can we do to stabilize people's lives? We know that the impacts are going to be long lasting, and we know that these issues existed before COVID-19. They were simply exacerbated and made more visible and visceral to people through the pandemic. So what does the American Jobs Plan and the Americans Family Plan, what does it do to support women and women's health? Let's start with childcare, right? So we know that if you are a person seeking out healthcare, you have to coordinate that appointment. And not only do you have to coordinate that appointment, meaning you have to figure out, does that person actually take my health care coverage? Is that person available? How am I getting there, right? When we're talking about infrastructure and we're talking about health, it's much more than just the direct care. It's also how a person gets there. It's whether or not they have the ability to take off from their work. And even if they do have the ability to take off from their work, are they in a financial position where it would be precarious for them to miss 2 hours, 3 hours to go to a medical appointment? So do they have paid leave? Do they have paid medical leave? Are they in a financial position to be able to miss work? And also we know, they have to potentially coordinate childcare. So is there a childcare infrastructure that supports that person being able to then go and attend that doctor's appointment? So childcare, as has been highlighted over the last 14 months, is incredibly important. And so there is a significant child care investment. We started with the investment in the ARPA, where there was 39 billion allocated for funding for childcare. The American Jobs Plan calls for an additional $25 billion investment, essentially to upgrade and increase the supply of childcare facilities and incentivize businesses to open their own childcare facilities. What we envision at the Law Center is an equitable and comprehensive childcare systems that ensures that every single family has access to high quality, affordable childcare. And of course, that allows for living wages for the people who are caregivers and early childhood educators who provide that care, essentially pay equity or parity rather with elementary school teachers. So we're talking about childcare, but we also have to take into consideration the impact of housing on women's health. So if you have housing instability, that lowers the likelihood that you will attend doctor's appointments, lowers the likelihood of compliance with healthcare plans, lowers the likelihood of being able to efficiently if you have a medication that requires, a particular type of storage, et cetera, compliance with that. So housing definitely impacts, and housing instability in particular impacts someone's ability to access healthcare. ARPA laid the foundation and provided $50 billion in housing and utility assistance. The American Jobs Plan includes $213 billion investment in preserving and retrofitting some homes, $40 billion in particular under that 213 to improve public housing and resources to support home ownership and address the growing and problematic rise of rent. we at the Law Center would encourage some additional specific investments. So to fully fund Section 8 housing vouchers, ensure that every eligible family has access to the assistance to help pay their rent. And then also an investment of $70 billion for public housing to address the backlog of repairs and maintenance that needs to occur for existing units. Also, we have to talk about paid leave, right? So at the top of my remarks, we talked about the fact that if somebody has a choice between maintaining their employment and going to a doctor's visit, the likelihood is that they are going to do what they have to do to preserve their employment, because their employment impacts every other facet of their lives, and they will sacrifice their health. And so paid leave is critically important. The ARPA expanded tax credits that for employers who provided emergency paid leave and paid sick days, but it did not reinstate the requirement that those paid leave and sick days be provided. And so the American Families Plan does talk about creating a comprehensive paid family and medical leave program, and that is incredibly important. We would also just be very explicit in the need to establish a national paid and family medical leave program that again provides at least 12 weeks paid leave, which tracks with the American Families Plan recommendation. And finally, let's talk about tax credits, right? So financial stabilization of families is really, again, a critical part of maintaining good health. If you are choosing between, a copay and groceries, or you're choosing between your medication and rent, those are never the choices that you want to make. And unfortunately for women, because we are grossly underpaid and we are overrepresented in low-paying jobs, because our our labor has been systemically and historically undervalued. That leaves us in, unfortunately, a financial predicament of just having fewer financial resources. And so when we're talking about tax credits, that pushes people sometimes out of poverty and allows access to additional resources that they otherwise wouldn't have. So the American Families Plan does extend some key tax reform components and extends the child tax credit, earned income tax credit, and child and dependent care tax credit. We would urge at the Law Center that not only should these extensions be made, but they need to be made permanent. So you have to make permanent the expansion of the earned income tax credit, make permanent the expansion of the child tax credit, make permanent the expansion of the dependent care tax credit. Those are aspects that allow for not only the lifting of children out of poverty, but also to help stabilize women and their families and significantly improve health outcomes for all. So, and all of this, of course, is in addition to the increase in subsidies for folks who are enrolled in ACA marketplace plans, and the American Families Plan does make those extensions permanent as well. So those are the aspects of the American Jobs Plans and American Family Plans that impact women and their families, especially when you view health really holistically, and acknowledge that every aspect of a woman's health or every aspect of a woman's life impacts their health.
Thank you, Dorianne. Let me ask you a quick question. This is probably going to be a tough one given how important all of these investments are, but of them, which do you think will have the most meaningful impact on women and families?
That is so hard. It's hard, even though I knew you were going to ask this question, it's still really tough. Honestly, they're all so critical. If I were to say, if we're talking about, so obviously anything that makes healthcare more attainable and reduces cost as a barrier to care has to be at the top of the list, right? So I would say that subsidies that are lowering the out-of-pocket costs or I shouldn't say out-of-pocket costs because those are for premiums, but lowering the cost of premiums and also, the cost sharing reduction that lowers out-of-pocket costs. Those things are critically important, as we have good data that demonstrates that women, are more likely than men to delay or deny themselves care due to cost. So removing cost as a barrier to care is incredibly significant. And then also I'll just say childcare, right? Because women, again, data supports this, that women are the primary caregivers, not just to, dependent children, but also to loved ones. And so anything that reduces the toll that takes is something that's really significant for women.
Thank you.
Thank you.
Okay, we have one more panelist that we'll hear from before we enter into our fireside Q&A. Just a reminder, if you do have any questions for any of our panelists, please just type it into the Q&A box that's at the bottom of your screen, and we will move into Q&A right after we hear from Sue Peschin. Sue is the president and CEO of the Alliance for Aging Research and has led the organization to reduce older adult immunization rates, increase NIH Alzheimer's disease and aging research funding, and address costs of healthcare and value frameworks, and reform Medicare treatment access issues. She participates in major industry and policy symposiums around the country every year and serves on several boards. Welcome, Susan. Sue.
Thank you, Arika, and hello, everyone. I do want to thank Beth and the Healthy Women team for inviting me to participate in today's event. I'm often the only woman on a panel, so this is a joy for me. I'm focused today on how provisions in the Biden administration's America's Jobs Plan and the Families Plan can support Americans as they age, and specifically women. And I also want to touch a bit on international reference pricing for prescription drugs, since it's been discussed as a way to pay for some new and critical programs. Now, Megan spoke very thoroughly and expertly on telehealth, so I'm going to limit my comments, but I did want to just say a couple quick things. Overall, the many policy changes that have been instituted to increase access to telemedicine during the pandemic have helped address availability, use, interest, and comfort level among older adults, which were, previously could be barriers. But ongoing research by Keith Lamb and colleagues at UC San Francisco that was just published last October in JAMA shows that there are still about 1 in 5 older adults that remain unready for telephone visits because of difficulty hearing, difficulty communicating, or dementia. And those are all issues not necessarily related to broadband access that the American Jobs Plan proposes to fix. Men are considered just slightly more unready than women. So let's dismiss the myth that women are less tech savvy. And I do want to make the point that older age remains one of the largest factors in unreadiness, with about 72% of adults age 85 years or older meeting the criteria for unreadiness. And these might not be surprising to folks who are listening, but I wanted to raise them as part of the discussion, since addressing broadband is definitely needed, but it's not the only issue leaving people behind. There's several proposals in both the American Jobs Plan and Families Plan that would be very meaningful to older adults and their family caregivers, particularly women. Women make up 61% of today's family caregivers, according to the National Alliance for Caregiving, who we partner with on a regular basis. And they are an awesome group if you don't know them already, as well as AARP, and they do an annual Caregiving in the US survey. And as the US population continues to age, the need to support family caregivers really as the cornerstone of society is going to become more and more important. Today, more than 1 in 5 Americans, about 21.3%, are family caregivers, having provided care to an adult or a child with special needs at some time in the past 12 months. So the proposal on the American Jobs Plan to provide funding for expanded home and community-based services for older adults and people with disabilities would be monumental. I am not exaggerating. The Medicaid program funds about 57% of home and community-based services, with private insurance that covers about 12% and about 7% entirely out of pocket. And it's important to understand state Medicaid programs must cover nursing home care, but most home and community-based services are optional. They require waivers and they result in substantial variation across states. So depending on where you live, it might be better or worse. And they face a number of challenges, including waiting lists for waiver services, direct care workforce shortages, and that predated the pandemic, and it was exacerbated by the pandemic, and then a lack of affordable, accessible community-based housing. So the new $400 billion in federal funds from the American Jobs Plan could really increase annual spending substantially in the Medicaid program by about a third. Extending the Medicaid's Money Follows the Person program is one specific policy proposal, and that is a great program that provides enhanced federal matching funds that from 2008 to 2019 helped more than 101,000 seniors and people with disabilities across 44 states and the district to move from the nursing home to the community. And states can help fund services like the first month's rent, household setup costs, and staff to help enrollees locate community housing. And program evaluations found improved enrollee quality of life and cost savings after you move from the institution to the community. But there's been just a lot of instability with the funding, and this proposal is going to help fix that. And Medicaid doesn't pay for housing, of course, but many states have used these funds to hire housing coordinators. So it also has that benefit to help collaborate with affordable housing agencies and assist folks with finding community-based housing. The jobs plan also expands and strengthens caregiving jobs that are supported by Medicaid home and community-based services. And direct care workers who provide these services have been disproportionately affected by the pandemic. The workforce is predominantly female, low wage, and people of color, and making additional federal matching funds available under the Medicaid program will enable states to increase provider payment rates, which in turn, hopefully, is going to allow provider agencies to increase direct care worker wages and benefits. And just, allow many more people to take advantage of being able to stay in the home and in the community as opposed to going to nursing homes. Paid family leave in the American Families Plan is another proposal that's been talked about for decades, and it's really great to see it. As all of you listening, I think probably know, the United States is one of the few countries in the world whose government doesn't offer a national paid family leave program. Families currently have to deal with a loved one's long-term illness or disability by taking off work or taking home a fraction of their usual income. And some states have policies in place and some companies help, but most fall short. Dorianne spoke to this issue as part of her remarks that oftentimes employees have to return to work too soon or leave the workforce entirely. And I actually saw that today there was a study released by both Harvard and UC San Francisco, and they looked at service sector workers, and about 2/3 of them said they couldn't take leave or took less leave than they wanted when they experienced a major life event. And within this group, 71% said the reason was affordability. So the American Families Plan includes 12 weeks of paid family leave. They could reach as high as $4,000 a month, depending on a worker's income. And they would replace between 66 to 80% of the infected employees' wages. And it would also allow for 3 days of bereavement leave, which we often forget about. So this is a much needed and exciting proposal. It's also exciting for us to hear about the White House and some in Congress speak about expanding benefits in Medicare to include hearing, vision, and dental services. These ideas also go back decades, and Congress has yet to make this happen, despite the growing need for the program to address these issues among older adults. One of the reasons why these programs can be tough to get over the finish line is due to issues with policy proposals to pay for them. And here's why I want to talk about drug pricing for a bit, since it's been bandied about as a way to help pay for some of what we've been discussing at certain points, not so much right now with the infrastructure proposals, and then also with expanding Medicare benefits. House Democrat leadership, as well as the previous White House, were, have talked a lot about direct Medicare negotiation through the use of international reference pricing. And international reference pricing, for those who don't know, would tie the price that Medicare pays for some drugs to those paid by other countries. And we strongly oppose any international reference pricing proposals. And I want to explain why, because, logically, when you think about it, if other countries are paying less, it seems like, well, why are we paying more? We shouldn't be doing that. But I want to point out that all of these international reference pricing proposals share a common flaw that's important for people to know about. They would import to the United States the use of discriminatory cost effectiveness standards that other governments use. And that might have your eyes rolling up into the back of your head in boredom. But as we all know, a lot of times, boring policies are the ones that can be the most insidious. So many of the reference countries that are in these proposals, like the United Kingdom, Canada, Australia, they make drug reimbursement and coverage decisions based on cost effectiveness assessments that are tied to what's called the quality adjusted life year, or the QALY for short. And what does the QALY do? Well, they assign a value to the patient population and treatments intended for. And they're based on the perceived value of living with a given condition in comparison to being in perfect health. They're usually measured from 0 to 1. 0 is death, 1 is perfect health. You can be less than 0, and that's often judged for certain conditions like ALS and Alzheimer's disease, kids with a moderate to severe Down syndrome. The actual impact of QALY-based cost effectiveness is really big, because if a treatment is for a group that's sicker, older, or includes people with disabilities, or if it's focused on a population that has historically faced inequities in society and in the healthcare system, the treatment is often assessed as being less valuable. Or another way of saying it is that those groups are considered more expensive to treat. And by concluding that a treatment is not cost effective, insurance companies can justify restricting access by not covering it or using management techniques like step therapy to effectively restrict access to it. So saying you can't get the new thing, you can try 1 or 2 old things first. And then if those really don't work or you get a lot sicker, then you can finally get the new thing. Healthcare rationing is very common in some of these other countries that I've mentioned, and that's what we would be doing here if we adopted this. And I'm not just saying this just ourselves. In 2019, the National Council on Disability, which is an independent federal agency, cautioned against relying on the QALY because it would undermine the Affordable Care Act and major US disability and civil rights acts like the Rehabilitation Act and the Americans with Disabilities Act. And in April 2021 of this year, the council sent a letter to the Congressional Budget Office expressing its concern with the agency's use of QALY to score HR 3, which is the big Democrat drug pricing bill in the House. And it stated, this makes light of the fact that the QALY assigns a lower value to the lives of people with disabilities and chronic illnesses. And it also ignores the fact that countries that rely on the QALY to set drug prices have restricted or denied patients with disabilities access to effective drugs used to treat chronic conditions and to breakthrough medications. And even in 2020, the Democratic National Committee platform had something on QALYs that said Democrats will ensure that people with disabilities are never denied coverage based on the use of quality adjusted life year indices. So given clear statements like these, we don't want to see policies that rely on QALY-driven international pricing metrics. We think they should be prohibited, not embraced. And we definitely share policymakers' interest in reducing Medicare healthcare costs and all healthcare costs and to help pay for expanded services. But international reference pricing misses the mark. And we really want to see it let it go for good. So thank you. I look forward to questions and to discussion.
Thank you so much, Sue. So we will now transition into our fireside discussion. We have about 20 minutes left, and I want to make sure we get to some additional questions. And if anyone in the audience has questions, again, please do just type them into the Q&A, and we will be able to have an open discussion with all of our panelists. But I do want to start first with the ACA. It's come up quite a bit throughout the discussion here. And let me direct it to you, Dorianne, especially given your Supreme Court expertise. With all of the investments that were made in the ACA, including the enhanced subsidies and the special enrollment period, we still have a pending decision related to the ACA. Can you speak to us about what really is at stake here?
Yeah, I don't think that we can overstate what's at stake. Invalidation of the ACA would have incredibly far-reaching consequences, beginning with at least 20 million people immediately losing access to their healthcare. But in addition to that, we'd be losing critical reforms and protections that have meant the end of discriminatory and harmful insurance practices, protections for pre-existing conditions, ensuring that plans have to have comprehensive coverage that meets women's needs. I mean, before the ACA, maternity care was something that you had to purchase many times separately. It would end, the prohibition on charging women more for healthcare coverage than men. It is, I don't think that we can overstate what's at stake. And that's in addition to, particularly for low-income women and many women of color who have, again, because of historical undervaluing of labor, have been in lower paying jobs. The expansion of Medicaid is a part of the Affordable Care Act and has allowed for millions of women who would otherwise not have access to coverage or care to have that access. And so the ACA has been monumental for women and increasing rates of coverage, lessening, narrowing some of the disparities, and really saving American individuals and, collectively our country money. I mean, based on really uncompensated care, based on narrowing of health disparities. Health disparities cost us millions of dollars each year. So the ACA has been a critical investment in our nation's healthcare, and this case and the potential of invalidation or even partial invalidation is would throw our entire system into flux. And I think that not only would that have an impact on individuals and families and obviously women, but really on our nation.
Thank you, Dorianne. Any other thoughts or views from our other panelists? Okay, let's talk a bit about health disparities, because certainly this has come up quite a bit, especially as we think about women and healthcare issues. And the American Jobs Plan and the America Families Plan proposes a large monetary investment in childcare, paid family and medical leave, and various tax credits and other economic supports. What are some of the provisions that really are game changers? I'll start with you, Sue.
Sorry. I mean, I think that certainly the family medical leave, most of the things that I talked about in my remarks are true game changers, and they've been talked about for a very long time. Also, more support for home and community-based services. People are interested in that. And, I'm hoping that we can also move to the same dynamic that we have with nursing home care will one day apply to home care, that it's, required to have coverage. And there also needs to be, I think, better coordination between the Medicare and Medicaid programs themselves, which I know the administration is also working on. It's not necessarily a part of these two bills. But all of the proposals I talked about will enhance family caregiving and support for women in particular who are having to leave the workforce in order to do that, and to really make sure that they understand that they matter and that they should be remunerated for the services that they may be offering at home to loved ones that would otherwise be borne by public programs.
Thank you, Susan. Anyone else want to weigh in on terms of what are the real game changers from your perspective? Okay.
I'll go. Yeah. So again, I think all of these intents are great. Again, I think, a lot of us have been through the housing collapse, 2008. And I actually going to date myself here, but I graduated college and went to look for a job the summer after 9/11. So I think a lot of us who've been in the working world have seen sort of like this sort of ebb and flow of what happens after sort of a catastrophic event, which is pretty much what we just went through. And what I do feel concerned about are, as a small business owner, it was very challenging for me to start my own business and come out of employer insurance and buy my own insurance. It was challenging for me to find help to do some administrative work. We've certainly spent an enormous amount of money. We have really needed to do that to prop up the economy. I think everyone realizes that. But moving forward, I think we're in a situation where we don't want to inhibit growth in the small business community and in the innovation and technology community. It's just going to stifle. I think when we look at doing all these wonderful things, I think we also have to look at where it's coming from, because when you give one side, you take from another. And I feel, especially our generation, my generation, maybe we're more individual. So we like to, I just feel like a lot of my friends and colleagues have started their own businesses. And I think with that, we want to make sure that we prop up the economy so that we have a good, solid foundation for that kind of growth. And I just feel like taking, there can be a place here where it starts to stifle those types of innovations when we're, putting pressure on, places like tax, or when we don't have the ability to have, workers to help people who are growing business. So I just wanted to throw that out there too, that, that's something I think it's not always thought of, but when you gain something, you lose something. And the big picture sometimes doesn't always get clear until you're trying to go through the policy, and the intent might not always be what happens in practice.
Thank you, Susan. Well, I'd like to, as we wrap up, just to hit on, what's missing. So we've had a really robust discussion, and I think we've hit upon a lot of the important provisions that are in both of these legislative proposals. But from each of your perspective, would like just to hear what you do think is missing, or, perhaps should be a higher level priority. Megan, we'll actually go ahead and start with you.
Sure, no problem. And I think my answer to the previous question, possibly this question too, is probably pretty obvious since I have such a focus on telehealth. But what I would kind of point out there, in addition to the broadband piece and that part of the infrastructure, is just that thinking about access to remote care in terms of Medicare, Medicaid, public program, but also private insurance, reimbursement and coverage, could and should be considered part of infrastructure, right? Because as healthcare systems or healthcare providers are trying to determine how to move forward with their own infrastructure. So if you think about a big hospital system, they're determining, should we invest in the technology in different platforms for our providers to be able to reach patients remotely, whether, again, through multiple different modalities, whether it's a video visit or a text-based service or some other type of program, remote patient monitoring. Should we invest in the technological infrastructure to make sure that our patients can access those types of services? the big question for them is can we get paid to provide that service, right? So if we don't address the reimbursement policies, then providers won't be able to make those investments in the infrastructure. So we're not always talking about, money for iPads or things like that, but we are talking about making sure that providers can get paid for the services that they're providing, which then impacts the access to care for patients. And I would be supportive of kind of like multiple different modalities available to providers, and really just removing restrictions that keep them from being able to do that. And so the policy angle on that is just that it can be difficult for them to make those investments in infrastructure when the policy around reimbursement is uncertain. Because if they know they're going to get paid for 6 months, but then not after that, why would you invest in long-term technology to provide that access?
Thank you. Dorianne, what's missing from your perspective?
Well, I think I wouldn't necessarily say what's missing. I will say that extension is not the same as permanence. And so there are a lot of provisions that are extending good things that need to be made permanent. So that's the first thing I would say. The second thing is that, when at least at the National Women's Law Center, when we're looking at, sorry for the background noise, when we're thinking about what is driving the uninsurance rate, particularly among Latinx women, we have to think about how intentionally we are addressing healthcare access as it intersects with immigration status. And so I think that if I were to say what's missing, I would like to see more intentionality in ensuring that we are aggressively reducing the rate of uninsurance amongst our Latinx community members.
Thank you, Dorianne. Susan?
So I think one of the things that's missing is the opportunity here to invest in ideas and proposals that will control the cost of the healthcare system, but focus on value. So we have consistently talked about the fact that people go to the hospital and they go to the emergency room and they go to emergency clinics, but all of these things in tandem, like women who have childcare, women who can take off a day of work and go, all of these things in tandem could lead us to a good place to provide better quality of care and control the cost in the healthcare system. And so I think we're kind of missing an opportunity to be able to do that. We have a lot of telehealth is a great example that women can get, and I have taken my children and gotten them telehealth visits and been able to work at the same time, which is crazy because before, you took like 2 or 3 hours. So anyways, that's what I would say.
Speaking of being a working mother, we understand. And we'll end with you, Sue. What are your thoughts in terms of what's missing?
Well, I want to agree with both Susan and Dorianne. I think addressing total costs of healthcare is missing from the discussion. There's sort of a lot of over focus on particular aspects of it, but not on sort of the whole picture. And I think, there's been a vast increase in the pre-Medicare population for high deductible plans, which can be very difficult for folks to be able to pay, and it makes them, not want to get insurance at all. There's a lot more higher cost sharing. And the other thing I wanted to mention is I think that there is a bit of misinformation about costs of care in Medicare sometimes that, our population is still consistently aging and will be for the next several years. And a lot of times the focus is on the costs of services and products, which can be a problem, but there is also an increased utilization. of drugs, of medical services, of, you know, people needing to go to the doctor, just because the population is aging and more people are entering the Medicare program. And Medicare, the Medicare actuary and their reporting actually says this in a lot of their studies, but we tend to focus a lot on, we got to get sort of costs down. So I think some of this also is just, you know, speaks to ageism in our culture as well. And I'm hoping that we can kind of address some of these issues. It was such a huge issue during the COVID pandemic. And I just don't think that we've talked about it enough in hindsight to the pandemic yet.
Absolutely. Well, thank you to all of our panelists today. I think we've had such a great and robust discussion, not only about these two very massive legislative proposals, but just about how important women's healthcare is, especially right now in this post-pandemic, if we are calling it that, world. So thanks to all of you for taking time out of your schedule. And thank you to all of the attendees who have joined us today. We really appreciate your time as well. And thank you to Healthy Women for hosting this great panel. With that, I will turn it back over to Beth, or we can go ahead and close out. On mute, Beth.
Gosh, of course I'm on mute. I just wanted to say thank you all. I love the conversation and we look forward to working with you all again soon. Thank you.
Thank you.
Thanks, everyone.